Hello everyone. Today we discuss about how to make a drug book in any subject, OBG or any other subject. Drug book contain 10 normally generally drug. Let's go how to make a drug book. First is the seal. First you have to draw horizontal line, vertical line, and first come to drug name, dose, route, action, indication, contraindication, side effect, nursing responsibility. First drug name is azithromycin, dose 250 mg, 500 mg for adult, 200 mg for children. A route is oral. Action: azithromycin decrease the productive of the protein and stop the bacterial growth. Indication: COPD, pneumonia, skin infection, urethritis, STD, conjunctivitis. Contraindication: hypersensitivity, vomiting, diarrhea. Side effect: diarrhea, vomiting, nausea, abdomen pain. Nursing responsibility: to administer medication at proper time, to check any sign of adverse effect, to administer drug with plenty of water. Next come to the second drug. Name is ofloxacin. Dose, route, action, indication, contraindication, side effect, nursing responsibility. So the dose of the oxofloxacin is 200 mg for adult and 100 mg for children. Oral. Route is oral. Action: it is broad spectrum antibiotic. It inhibits the DNA tropoisomer enzyme so that inhibit bacterial cell wall synthesis. Pneumonia, UTI, tuberculosis, spherical infection, otitis. Contraindication: hypersensitivity, live disease, pregnancy, epilepsy. Side effect: nausea, vomiting, diarrhea, headache, insomnia. Nursing responsibility: administer medication at proper time. To administer drug with plenty of water. Third drug is paracetamol. Drug name, dose, route, action, contraindication, indication, contraindication, effect, responsibility. Dose 120 mg to 1 year child and 250 mg for 1 5-year child, 325 mg, 500 mg, 650 mg for adult. Route is oral. Paracetamol is active oxygen in the brain, which account for the antihypertensive action. Indication: fever, mild to moderate pain, toothache. Indication, contraindication: hypersensitive, vomiting, hypertoxicity. No side effect of paracetamol is nausea, vomiting, dizziness. Nursing responsibility: to examine high nail, to carry out left AST act, beryllium creatinine, to examine WBC HB. Next drug is promethazine. Dose 100 mg for adult and 125 for children. Route is oral. Action: block the action of the acetylcholine and stop the nausea and motion of sickness. Indication: vomiting, nausea, motion sickness. Contraindication: nausea, vomiting, motion sickness. Side effect: drug mouth, blood, vision, urine retention, constipation. Nursing supposed to monitor the vital sign of the patient, assess the patient, nausea, vomiting, abdominal disturbance of the bile, so before and after administration. Next come to the fifth drug, motrindazole. Dose 1 gram 400 mg. Route oral, intravenous, IV. Action: antibiotic that inhibit the partial antibacterial in human body. Contraindication: sulfide, necrophobic infection, bacterial. Contraindication: hypersensitivity, intra retardation with contraindication with alcohol. Affects stomach ache, headache. Responsible to administrate the medication at proper to check for any sign of adore effect. To administer drug with plenty of water. Sixth drug is ciprofloxacin, dose 50 mg, route oral, inhibit the bacterial DNA synthesis mainly by DNA. Indication: Lirite with diarrhea. Contraindication: diabetes, low blood glucose, seizure, receptor of a tendon, lung or heart transplant. Side effect: restlessness, rashes, hypersensitivity reaction. Nursing responsibility: monitor patient by intake output chart, watch the sign. Seventh is LME, dose 6.25 to 1.25 mg in adult, route is oral, action blood vessel and sensory trigger. Acute indication is acute treatment of the migraine. Indication: hypersensitive cardiovascular, controlled hypermesis, headache. Inform patient that should only use drug migraine attack. Then it comes to a drug alprozone, dose to 0.25 mg to 2.3 daily for adult, route oral, act as many level in the CNS to produce analgesic relief effect, relief of anxiety. Indication: treatment of anxiety, management of patient. Contraindication: hypersensitivity, pregnancy, lactation. Side effect: dizziness, drowsiness, nausea, vomiting. Nursing responsibility: monitor the patient to take medication directly as prescribed, do not sleep or double sleep done. Night amoxicillin, dose is 20 to 40 mg for children, 250 to 500 mg for adult, route is oral, bind to bacterial cell wall and cause cell death. Indication: tonsil, bradycardia, pneumonia, ulcer. Indication: hypersensitivity, phalanges. Side effect: diarrhea, dizziness, heartburn, insomnia, nausea, vomiting, abdomen pain. Nursing responsibility: monitor bowel function, diarrhea, abdomen cramping, fever, and blood stool should be healthcare professional. 10 drug is dopstrone, dose 100 mg for adult and 1 to 8 mg for infant. Route is oral, action back the effect of the sedation at receptor site located at the vagal nerve termination in the chemoreceptor triggered 30 vs in the CNS. Indication: vomiting, nausea, headache. Contraindication: hypersensitive, side effect of headache, dizziness, cardiac and pain, fatigue. Nursing responsibility: patient for nausea, vomiting, monitor vital sign. So this is all how you can make a drug book in any subject. So these are the general drug you can write in any subject: a note physio, community health nurse, child health nurse, and OBG. All these drug can work in all the subject. So kindly subscribe my channel and hope you like this video. Share this video to your friend, share this information, and thank you.